Welcome to ongoing election coverage by Town Meeting Television. You are watching state representative candidates for Chittenden District 8-2. This is one of 22 forums being brought to you in advance of the general election in November. All candidates on the ballot are invited to participate in Town Meeting TV election forums. These forums introduce you to community decision makers and connect you with issues that shape your local community. If you are watching this live, we welcome your questions at 802-862-3966. Watch Town Meeting TV on Comcast Channel 1087, Burlington Telecom Channel 17 and 217, as well as online at Town Meeting TV's YouTube page. So joining me today are candidates for Chittenden District 8-2 representative, and we'll begin with opening statements. Candidates will have about a minute and a half to share why you are running and what experience you will bring to the position. I'm going to start with Karen Dolan here.
Great, thank you, Kristine. And thank you for this opportunity to connect with voters. Before I talk about me, I thought it was important to just share that, take a moment and recognize that today is Indigenous Peoples Day. And I feel very fortunate to live in a state that recognizes this day and really believe it's one step we can take on our journey to honor the culture and heritage of Native American communities. I'm gonna give a minute for that. And back to why I'm running. I'm running for state rep in Essex Junction because I believe in the values of collaboration, curiosity, and connection in order to create progress for our community. We have tremendous work ahead of us, and we need leadership that understands the importance of listening, finding common ground, and lifting each other up. A bit about me. I grew up in the Northeast Kingdom. After high school, I attended the University of Vermont, where I was the first in my family to graduate from college. Since then, I've spent the past 20 years leading initiatives and implementing programs throughout Chittenden County nonprofits. It's in this work that I've learned about Vermont's food security systems, work readiness resources, gender equity programs, as well as criminal and restorative justice. I currently work at the Essex Community Justice Center, where I've been for the past 5 years. If elected, I will carry these same values and experiences to the State House.
Thank you. Lori Houghton, same question to you. Why are you running and what experience do you bring?
Thank you. And Karen, thank you for that introduction earlier. I'm honored to represent Essex Junction and have thoroughly enjoyed the last 4 years talking with our residents and working on issues that are important to our community, such as ensuring Vermonters can take care of their families by supporting paid family leave and increasing minimum wage, ensuring strong schools and childcare, addressing climate change, protecting women's reproductive health, and protecting youth by raising the smoking age to 21. As ranking member of the Healthcare Committee, I led and helped pass legislation expanding telehealth, codifying into state law consumer protections found in the Affordable Care Act, such as pre-existing condition bans, and ensured the coronavirus relief funds were allocated strategically and equitably. 2020 will definitely go down in the books as a memorable year. The pandemic has disrupted nearly every aspect of our lives and brought to the surface the many inequities in our communities and support systems. The impact on Vermont small businesses has been profound, and we see more clearly the connection between childcare and a successful economy. I'm running for re-election because I care deeply about the well-being and future of Vermonters. We need voices in our legislature that represents our communities. As a working mom and small business owner, I am that voice. As mentioned earlier, I'm currently serving as ranking member on the House Healthcare Committee, served 8 years as Essex Junction trustee, and have spent over 10 years volunteering in our schools and our community organizations. I have a proven track record of collaboration and leadership, both in the State House and the village, and a commitment to our community. Thank you.
Thank you. And Brett Gaskill, why are you running and what experience do you bring to the position?
Well, the reason I'm running is because I think the people of Essex Junction, as well as the whole state, deserve to have a voice and have a choice. It's been quite evident for many years. I've been living in Vermont for 25 years, and the situation for the average person, the working person, the average business person has gotten worse and worse. as our control of our legislature has become more and more controlled by one side. It has gotten, like I said, worse and worse. It has become extremely unaffordable. The taxes are outrageous. The regulations on business get worse and worse. Businesses are leaving, and people, I think, are starting to understand that the problems are not going to go away if we keep doing the same thing, electing the same people, because if one of the things they've proven is they're deaf to the complaints that the average business person, the average family, the average parent. The control that we've seen has driven many child care centers out of business. That's why there's a shortage. But it's time that people have a choice, people have common sense, and that's what I bring to the table.
Thank you, Brett. Getting a little more specific, I'd like to ask about impact and what will be different for the people of your district or the state as a whole because you are elected to this position. What qualifies you to make those changes happen? And I will start with you this time, Lori. Oh, you're still on mute, Lori.
Sorry, I have family members running around. I apologize. I hope people in Essex have seen a difference since my election in 2016 already with the communication and collaboration that I bring between Montpelier and Essex Junction. My current seatmate, Dylan Giambattista, who is not running, and I have been holding monthly community conversations since our election in 2016. In 2018, we turned those Essex-wide conversations that have now connected residents with all 5 representatives. And those conversations have been extremely important into what we focus on when we go back to Montpelier. I alternate weekly Front Porch Forum updates with my seatmate and provide updates on Facebook and via my website. Communication is vital, and Vermonters, especially people in Essex Junction, need to know and understand what is happening in Montpelier. More importantly, they need us to take their voices to the committee rooms. Within the State House, I've built a reputation as someone who collaborates with all stakeholders and reaches out to seek the input of Vermonters. I work by the mantra of don't do anything about me without me.
Thank you. And Brett, what will be different for your constituents or the state as a whole should you be elected to this seat?
Well, I think I'll certainly bring a voice to at least the local people, especially the businesses, and be an advocate for them. I'd also like to get involved with parents that are very dissatisfied with the quality of education. We have seen our test scores for our children just get worse. There's no improvement. They are absolutely an embarrassment in terms of Western countries. We spend more than probably anybody, and yet we waste time on ridiculous indoctrination, hate, their training that is going on based on hate, revisionist history. And so I want to help parents to address that. I think the next Trump administration is going to be focusing on this, and I hope to work with contacts I have within the Trump administration to focus this and put an end to some of this awful indoctrination that our kids are dealing with.
Thank you. And Karen, finally, what will be different for your constituents or the state should you be elected?
Yes. I was thinking about this, and understanding what you'll bring to a position is really an important step in ensuring that you are the voice that is needed. So a few months back, I took the time for this reflection and actually posted my commitments to the constituents on my website. And so I figured I would just share that for folks. So as your state representative, I'll bring my core values of connection, curiosity, and collaboration to the work each day through these following commitments: listening in as many ways as possible to better understand the needs of our community. 2, taking the time to make informed decisions. 3, serving as a reliable source of information. 4, bringing people together to achieve sustainable and successful outcomes. 5, dedication to creating communities that lift everyone up and leave no one behind. And 6, understanding that although I don't have all of the answers, I have the work ethic and determination to navigate the path forward. So for all decisions and all the work that I would do if elected, I will hold all those values and commitments going forward. And I think for me, it's because I'm invested in this state, a lifelong Vermonter. My family is here, friends are here, I'm raising kids here. I've worked here for the past 20 years in the public service sector, and I'm committed to the work.
Thank you. Now, getting a little more specific, I want to ask each of you about your priorities for the next biennium, and what is the most important piece of legislation that you think the House could take up and why? I'll start with you this time, Brett.
I'm sorry, could you restate the question?
Certainly. What is the most important piece of legislation the House could take up and why?
I don't know if there is any one particular thing. I think we just need to get responsible, get realistic. The state has been in a horrible financial mess even before COVID hit, and it's going to be amplified drastically. There is no way getting around these facts. The state has to cut costs, and that will mean cutting budgets, cutting staff. Our government, thanks to Pete Shumlin, we had gotten things fairly under control going back before Shumlin took office, and then he drastically expanded the payroll of the government in Vermont. Yet our citizenry has not increased. The number of kids that we're teaching in our schools is drastically down, and yet none of those costs get cut. So we need somebody that's responsible. It's going to take realistic looks at budget and stop all the nonsense.
Thank you. Karen, what would the most important piece of legislation you see the House take up next biennium?
Yeah, I think it's hard to say for just one. So I have kind of my top priorities. And I think right at the top is COVID-19 relief and recovery, continuing the work that this past legislative session did, because really there needs to be a focus on public safety. And then I think with that, there needs to be investments in our basic needs, in our safety net. Does everyone have adequate and affordable access to all of their basic needs, such as healthcare, housing, education, and also childcare system? Looking at that, it was a critical piece before all of this, but I think we've seen through the pandemic of how more critical it is. And it's really essential for not only our children, but for the folks that work in the system, for parents who are trying to get to their jobs, and for those employers. So if that is a system that really needs a critical look at it. And then also continuing the work of racial justice actions. It's another area where COVID-19 has really amplified the cracks or the inequities in the system. And now is the time for us to rebuild smarter, not just go back to how things were, but really help to lift people up. So we need to make sure that we have diverse voices at the table when we're looking at revamping these programs. And so those are areas for me, but I also know that there's a lot of work to be done, and I'm looking forward to collaborating with folks and getting as much done as we can.
Thank you. And Lori, your priority legislation for the next biennium?
And I would agree with both Karen and Brett. You can't pick one. The needs are vast. So for me, it's financial and economic stability for residents and businesses, protecting the health of Vermonters, and ensuring equity in all systems for all Vermonters. These are broad and difficult issues that must be the focus of our state over the next few years. A health crisis has affected every aspect of our lives: education, access to work, food security, social isolation, housing, and so much more. Coronavirus in the national environment has laid bare the inequities and the racism in our communities, our social safety nets, and in the policies we pass. We must actively and thoughtfully make these issues our focus. As ranking member in the House Healthcare Committee, I will continue focusing on affordable and accessible healthcare, parity with physical and mental health, and health disparities in our communities and policies. Although new or expanded programs requiring fiscal appropriations will be hard to come by, I will continue advocating for strengthening our food systems, especially universal breakfast and lunch in our schools. I wish I could say there was one most important piece of legislation in the House, but the needs are vast, as I said earlier. If pressed for one immediate action we can take in January 2021, it's to pass paid family and medical leave.
Thank you. Viewers, you are watching Town Meeting TV Candidates Forum for Chittenden State Representative District 82. If you're watching live, give us a call at 802-862-3966 and ask your question of the candidates. Watch Town Meeting TV election coverage at www.ch17.tv or Comcast Channel 1087 in Burlington Telecom 17 and 217. Now, you all touched on budget a bit in your last responses, so I do want to ask how you would approach the next budget, what you would do to balance Vermont's budget. And I will start with you this time, Lori.
Thank you. Absolutely. Vermont should have a balanced budget. I'm sure you've heard this on other forums. We don't have a law that states that we must, but we always do. And we should approach the budget with the same thoughtful process we have been for the last several years. We must maintain the collaborative process between the committees of policy jurisdiction and House appropriations. Each committee has a budget liaison to someone in House appropriations. I'm that person for healthcare. And I will say, having the policy committees engaged in the process of creating the budget has been extremely beneficial. We're able to advocate for the program and funding that we know Vermonters need. The House Appropriations Committee also holds public hearings that are vital to get feedback from everyone. This process has worked in the past, and we definitely should continue it. We know the revenue shortfall will be significant. We don't have exact numbers, obviously, but there are several options before us. Using available federal funds to the greatest extent offered by their guidelines and advocating for them to allow us to use the money in ways that we deem is appropriate. Using rainy day funds, of which we have over 200 million, raising other sources of revenue, reducing our cost or borrowing. There are many more I haven't listed, but without having all the numbers and data, I really can't commit to what I would do. I will tell you, I believe we need to continue funding and advancing our social safety nets. Allowing our most vulnerable to fall further behind is not an option in my mind. I also know many of us cannot afford to pay additional taxes, so we must remain cognizant of this fact. At the same time, your legislative committee should be focused on the legislation previously passed to determine its impact and current relevancy. Difficult decisions will be required in the years ahead. I will continue to seek the input of village residents on the values you support when making fiscal decisions.
Thank you. Brett, I think you already spoke a bit to how you would approach the budget. Could you elaborate on how you would balance the budget for Vermont?
Well, with any budget, it takes going through everything with a fine-tooth comb. You have to look at everything in terms of what are your essentials, what are the things we must have, and what are the things we'd like to have. And sometimes you're going to have to just wait on the things that you like to have. I have a very good friend of mine who is extremely experienced in working with both businesses and governments and helping them find waste and getting it out of their system, making not only businesses work better, but governments work better. I intend to work with this individual closely, go through the budget, every section, and we get rid of the waste. It's the only way you're going to make things balance.
Thank you. And finally, Karen, how would you approach the upcoming budget? How would you balance Vermont's budget?
I think as others have shared, it's no easy task, and really see that it would be a multi-pronged approach that involves prioritized spending, new revenue exploration, and ideally continued federal stimulus. And the response really needs to involve significant community input. as we work to better understand the situation of our communities and our state as a whole and where our nation is headed. So for priorities, definitely focusing on the social safety net, healthcare, education, childcare, housing. These are the areas that must be prioritized in budget spending, along with the support for our small business community, which really is the backbone to so many initiatives across our state. In cost saving areas, our current situation has identified some areas where we might look at things differently and have potential cost savings. Through our efforts to reduce the number of people in our prisons, that could be an area to look at, changing policing strategies or shifting to online service delivery systems. I would want to continue that work to be creative. What are ways that we can look at cost savings? With new revenue sources, I think there's room to always be looking for that. In the past session, there was the regulated cannabis market that was passed. What are other opportunities? And even with these strategies, we'll really need to have significant stimulus at the federal level, which I'm committed to advocating for as needed for our community.
Thank you, Karen. I want to move on to ask about healthcare. The increasing cost of healthcare is putting pressure on Vermonters and the entire state's economy. And the COVID-19 pandemic has sharpened our focus on the inequities in healthcare. What is next for healthcare changes in Vermont? I will start with you this time, Brett.
I do have a lot of experience. I worked in healthcare for 20 years, plus having a number of, let's say, encounters with the healthcare system with either myself or close family members. One of the problems is that we have a system, the insurance system can work very well, but it's a very inefficient, wasteful system. I mean, it basically, if you look at insurance, the way it's set up, you know what? Everybody, you've got insurance for your car or for your home, and it's affordable and it works. But guess what? If you want to screw that up, let's make those insurances work the way your healthcare system does. It should be a two-tiered system. It should be most of our basic services should be paid for out of pocket, coming from pre-tax health savings accounts. It eliminates drastic amount of waste. Insurance companies should not be getting involved. Insurance was never intended to be used for regular expected incidents in your life. That's not what insurance is supposed to be about. So we need to change the way we look at it. Lastly, there are phenomenal physicians and other healthcare people in this country that are doing very innovative, very effective health delivery systems that are extremely affordable, and we need to really look at those.
Thank you. Karen, what do you see as next for healthcare in Vermont?
Yeah, with COVID, I think it's really shown us how essential it is for everyone to have adequate and affordable access to healthcare. When one of us is at risk, we are all at risk. So we really need policies that increase access to healthcare. We want folks having their health concerns addressed, and ideally at an early stage, not at a life-threatening or often very costly stage. We need to make it so folks feel that they can access healthcare without the potential of losing a job or going broke. So I would support policies such as universal healthcare, as it's a right for all of us, paid family leave, affordable prescription plans, screening and well visit coverage, and general education and awareness programs. And I also see that there needs to be continued investment in public health and social justice programs, because these are prevention tools for addressing healthcare costs down the road. One study that I think folks may be familiar with is the ACEs study, the Adverse Childhood Experiences. And this nationwide study spotlights the negative health impacts that occur later in life when children experience difficult situations such as divorce, abuse, addiction, and incarceration. So we really need to invest in programs that prevent these experiences and help ensure that folks in our community have healthy futures ahead of them.
You're on mute.
Thank you. Same question to you, Lori.
Thank you. And I'm going to forewarn you, you may have to cut me off because I could talk about healthcare forever. I first want to say I'm proud of the work that the House Healthcare Committee has done in the last few years. Prior to COVID, our committee was focused on rural healthcare system this year, and we put in legislation to mitigate provider burnout by minimizing prior authorization paperwork. We're addressing our workforce issue with additional funding for nursing and doctor scholarships. And we ensured healthcare is accessible to everyone by expanding telehealth legislation, including audio-only legislation. And we were working with stakeholders on addressing affordability, specifically those people who are falling off the benefits cliff right before, in fact, the week of the State House shutdown. And I hope that we will get back to that work next year. I would like universal healthcare for everyone, but we need the federal government's help. When we pass legislation in Vermont, we are only affecting a small percentage of Vermonters, those individuals and small businesses buying off the exchange and Medicaid. People who are in a self-funded program like the state employees or UVMMC, anyone with employment through, health insurance through their employers, and Medicare, we don't affect. So we need the federal government's help. I will agree with Brett. I think the healthcare system should be led by providers, not by insurance companies, and I would like to see that change. But most importantly, we need to double down on our healthcare reform efforts that are happening now. We're in the third year of a 5-year all-payer model reform method. That means we're taking all payers, Medicare, Medicaid, and commercial insurers, and putting them together, looking at the risk-based population and saying, okay, you get a fixed payment, providers, hospitals, to keep your patients healthy. Through that process, we're tackling population health, health disparities, and as Karen said, social determinants of health. We need to double down on that and keep focused moving forward with our healthcare reform.
Thank you, Lori. I want to pivot now to racial equity. Vermont has passed some racial equity legislation in the past few years. And I wonder, are you satisfied with where we are on our path to dismantle systemic and institutional racism in the state? And I'll start with you, Karen.
Yeah, so I'm definitely appreciative of the work that's been done. I think it's important and more is needed. This is kind of a never ending. There's always going to be work to be done in this area. And racial justice and equity needs to be a constant priority and topic of conversation in all of our decisions. We need to ensure that there are diverse voices at all decision-making tables to better understand the impacts our policies have on marginalized populations. We need to remain open to listening, and we need to understand that we need to change the ways we have done things in the past in order to create real change for the future. So I would look for recommendations from nonprofit and advocacy groups that best understand the opportunities for racial justice. We're fortunate to have many folks invested in racial justice in our state, and we need to listen to their ideas and plans. I would use my experience with restorative practice to fully listen and understand the needs and work to bring voices together. I'm also fortunate to have experience working on racial justice at our community level through VIEW, which is Voices for Inclusion in Essex and Westford. And I'm happy to be a co-facilitator of this group of volunteers from all parts of the Essex and Westford community that want to create more opportunities to discuss diversity and inclusion. And I really look forward to continuing this work if elected.
Thank you, Karen. Lori, do you think the legislature is doing enough to dismantle systemic and institutional racism here in Vermont?
Like Karen said, we've started, but it's not enough. As most people know, we passed 3 bills recently addressing use of force, corrections reform, data collection, body cameras, facial recognition, and more. Earlier in the biennium, I want people to remember that we took the first step of a constitutional amendment to remove slavery from the Constitution. And we created ethnic and social equity standards for public schools. But as I said, it's not enough. We need to ensure we are passing legislation that does not have implicit or explicit bias and look at policies that are already in place that are allowing systematic racism to continue. We must change the culture within the state house walls, as well as outside those walls, through training and education, but also by ensuring we are speaking up when we hear something that isn't right. And we must teach this in our schools and our police organizations. As we take up within legislation within each committee, we must begin to see that legislation through various lenses. Who are we helping? Who are we hurting? What are the consequences for all people? Vermont's Racial Equity Task Force released their first report just a few weeks ago in their first set of recommendations. There is something in this report for every committee in Montpelier, and each of us should make the commitment to address those recommendations. I also agree with Karen, we need to have a diverse group of people at the table. People with lived experiences need to be involved in the policies that are being set. Thank you.
Thank you, Karen. And Brett, same question. Do you think the legislature is doing enough to address systemic and institutional racism in Vermont?
I believe that racism, in whatever form, needs to be addressed, whether it be on the individual or whether it be in law enforcement, but it needs to be handled when it happens, and that's fine. And I stand with anybody that, regardless of your race, if you've been affected by it. But I roundly, soundly deny, I don't buy into this systemic racism. I think it's a load of dung. I think we're chasing things that don't exist or are much smaller than of a problem than what is being made to be out there. So I see a lot of effort being spent to cure problems that aren't much. Meanwhile, the big problems in our society, like I said, our schools, our government that is unresponsive, unresponsible, all of these things are being avoided. Nobody's dealing with the real issues.
Thank you, Brett. We actually have a caller with a question, so I want to move to the phone lines.
Wonderful. Due to the challenges that COVID-19 has presented for students and teachers, we are seeing a reveal of looming and new educational inequities. If elected, what will you do to combat educational inequity and strengthen our students' education?
Thank you. Lori, I think you're up for this one.
Great, thank you. You know, it's interesting. I have a 7th grader who has always, been good in school, average student. He enjoys it. And when the pandemic hit, obviously he stayed home. I work from home, so it was fine. We were able to make it work, probably better than most families. But I immediately saw just the real challenges and the real disparities between families. And in our family, my son thrives working remotely, and he's now fully remote this year. And I know there are families and kids who are really, really struggling. I've talked already to several members of our local school board to ensure that they're reaching out and making plans to actually hold some strategic sessions to say, what do we do going forward? We can't go back to the normal way we were educating our students. I think one important issue to also look at is the social services that are provided in our schools. I think it's really important that that's the place where most of the services are provided, because the kids spend most of their days there. But I don't think we have a real handle on what's being provided, how much it costs, and who actually is benefiting from it. And if we can break that out of the budget, look at it separately, look at those programs. Success Beyond 6 is a big cost driver in our state. And I think if we can start really digging in and saying, we can't do this the way we always have, we have some creative people and kids who will put forth the effort to make it a better education system.
Thank you, Lori. Brett, same question from our caller, I believe, about inequities in students' access given the pandemic that we are under?
Well, I'm not exactly sure what they're referring to in terms of the inequities. I mean, if everybody is having to telecommute for classes, you know, I don't know what the disparities are. I think it's an awful system. I think young kids need the interaction. I think the risk is extremely low for kids. That's been proven by science and medicine. And the kids need to get back to school. Some will get sick, very few, and their symptoms are likely to be very mild and can be dealt with. They need the interaction. It's awful what's being done to kids and what they're losing out on a key moment in their life. It's awful.
Thank you, Brett. Karen, inequities in access caused by the COVID pandemic.
Yeah, and I really appreciate the caller calling us up with this question. As a parent of 2 school-age children, definitely, a topic that I consider. And I think my first piece is listening. Like, I obviously have my experience of how my children are going through the school system, and I know that that's one experience. But I'll say with it, I have 2 children, and I feel like they're having 2 completely different experiences. They both have different challenges, different responses, different things. So I can only imagine what children who have different challenges and opportunities, how it's so different for everybody. And so we really need to make sure there is programs, data collection, their support, everything that's in place so that all kids have access to the education that they need. And the only way we're going to be able to do that is to really listen and bring people together. I feel like in our community, we have a robust network of folks with our school board and with our different school connected groups to have that voice, but I feel like we need to do more. The VIEW group that I said that I was a part of, the Voices for Inclusion in Essex and Westford, it is a group of community volunteers, but it also includes youth on it as well. And so we have students who are a part of that and are sharing these inequities. This was even before the pandemic. So these are there, and we need to come together. We need to come up with solutions. So my goal would be to not just have things go back to how they were, rebuild this stronger now, and continue that work going forward, even post-pandemic.
Thanks, Karen. I think we have time for one last question. I will ask you, what do you think is the biggest impact from the last 7 months of COVID shutdowns? And how should the legislature address that impact? I'm going to start with you on this one, Brett.
Say that again. Sorry.
What is the biggest impact of the 7 months of COVID-related shutdowns, and how should the legislature address that?
Well, I think, for one, I think the biggest impact has been the impact on people's lives. And I understand very well the dangers of COVID. However, the reality is the disease is drastically weaker than it was even a few months ago. We need to start opening up our economy. People have been destroyed financially. People that took their life savings, sunk them into businesses, and they were wiped out. We have a governor, while certainly better than the alternative, in my opinion, has gone far beyond what our Constitution allows. The situation, the realistic situation on the ground in terms of the number of people ill, suffering, so forth, is nowhere near what we're currently dealing with. Businesses need to be allowed to open, schools should open, and if not completely open, much greater than they currently are.
Thank you. Karen, what do you see as the biggest impact, and how should the legislature address that?
It's very difficult to land on just one impact, but ultimately, I would go with the fact that COVID-19 has magnified the cracks that exist in our social service safety net. And this impact really has been felt in multiple ways. It really done different things to connect with community members over the past few months. And it's been heartbreaking to hear stories from family and friends about their struggles to meet basic needs, folks losing childcare, unable to put food on the table, or just being behind in paying their bills. These were all issues that existed before, but they're even more extreme now. Extreme in the extent and also in the number of people experiencing these struggles. And for me, I feel like that's where there maybe is this very thin silver lining. Because these cracks have been magnified, more folks understand the importance of our basic need programs. We understand the importance of everyone having access to housing, to food, security, to healthcare, and it's become a bigger part of our community conversations. So this really creates an opportunity for us to make real change going forward. We must take these lessons and aha moments and move forward and move ahead with that insight.
Thank you. And Lori, what do you see as the biggest impact and what the legislature?
Yeah, I'm going to have to say there is no one impact. There's many. And if I can just continue off of what Karen said, because I agree with everything she just said. We need to look and go back and look and review the effects of the $1.2 billion of coronavirus funding relief. And where did we fall short? Where are the structural flaws? What policies did we change? Should we change now based on what happened? I think we need in the House at least to create some cross-functional teams within the committees to ensure we're all talking to each other. It was great when we were on Zoom and able to really pay attention to each other's committees. We cannot do that when we're in the State House. And there's a lot of cross conversations happening that we need to bring together. And all of that is to ensure that we're securing our social safety nets. How can we more effectively use the resources we have to ensure that no one population is left behind? Back to the caller's question too, I also think we need to reimagine education with a renewed understanding that children don't all learn the same way and that childcare and our economy are completely tied together. And then probably most importantly to me, again, is continuing with our healthcare reform to ensure that all Vermonters have equal access, are taken care of, and that we can afford it. Thank you.
Thank you, Lori. We are about at the end of our show. I think we have just enough time for you to each do a 30-second closing. Don't want to go in the same order I opened. So Brett, I will start with you and we'll go in reverse.
Me?
Yes, 30 seconds to close.
All right, I'd like to thank you for this forum. I'd like to thank the other participants here. Both seem like very nice ladies. But for the people of Vermont, especially those that are well aware of the problems we have, they are not going to get fixed by, if you listen to what they said. They have no intention, they haven't been listening, and they're not going to listen. And I think they may want to, but their leadership is not going to allow them. Lastly, the reality is that we recently had individuals, the majority of our legislature just passed a law that relinquishes their responsibility to the voters of Vermont. They turned over legislative authority to an unelected board. They have violated their trust. They have violated their constitutional responsibility. This is your chance to tell them what you think. Thank you for your vote.
Lori, 30-second closing.
Great, thank you. I always enjoy these Channel 17 forums, so I appreciate it. And I'm really grateful to be part of this democratic process. And I want to be clear that leadership does not dictate how we vote ever. I would like to continue the hard work facing our state by listening to Essex Junction residents and bringing their priorities to Montpelier and working with Vermonters on the policy decisions that will make all of our lives better. I'm available for anyone to reach out to, and I would appreciate your vote. Thank you.
Thank you. And Karen, 30-second closing.
Well, I'll end with some of the same words that I started with. I'm very thankful for this opportunity to connect with folks, and I'm running for state rep in Essex Junction because I believe in the values of collaboration, curiosity, and connection in order to create progress for our community. We have tremendous work ahead of us, and we need leadership that understands the importance of listening, finding common ground, and lifting each other up. And these are the values that I'll bring to the State House, and I look forward to your support.
Thank you. And thank you all for tuning in to Town Meeting TV's ongoing coverage of statewide and regional candidates. You can find this and more forums at www.ch17.tv. Don't forget to vote on or before November 3rd. Early voting by mail is available currently. Contact your town clerk's office, and polls will also be open all day on November 3rd from 7 a.m. to 7 p.m. Thank you for watching.